In the United States, HIV is criminalized. In the South, the southern United States, you see it even more. If you think about HIV, HIV started on the two coasts, right? East Coast, West Coast. We know New York, San Francisco. HIV now lives in the South.
The big AIDS epidemic hit pretty hard here. We didn't have anybody that had any knowledge about the treatment and stuff. I mean, it wasn't like San Francisco where they had a lot of research going on and all that, Nobody here was doing anything.
When I moved to Charleston, I was like, hey, I'm Reverend Robert Arrington. I moved here. I'm openly gay, and I'm also HIV positive. I watch everyone just shift from smiling to and after that, I was told, you're not gonna make it here. You just don't go around telling people, especially you HIV positive.
The HIV stigma is still huge. That is a big problem in the Latino culture. We're still fighting to overcome the stigma. So many people is still dying because of a stigma or the HIV stigma.
HIV is a very difficult subject to talk about in the African American community. So I started an organization that provided HIV services and that would focus on the African American community, receiving those services. I think the rate of HIV infections in the African American community will go down.
I don't think a lot of my colleagues in some of the urban areas really have a clue what it's like to live in rural Alabama. I wanted my brothers and sisters in the urban areas to care about the people living with HIV in the South, especially in the more rural areas. In the HIV arena, I can tell you that I am in a very enviable position in that I get to help shape policy, but at the same time, I get to see the frontline work and see how we are actually helping people live better lives, healthier lives.
So I use my own experiences to be able to advocate and to give support and to educate the community about what HIV is and what it does, and how can we as a community can actually have those conversations so to bring the stigma down. People still think that when you get an HIV diagnosis, that would be a death sentence, but it's not.
I'm HIV positive today. I do the work that I do because I don't want any other young people to have to live through what I lived through. It's very different today than it was before. We can now see a light at the end of the tunnel, and there's a clear map to the end of the HIV epidemic. Having HIV testing, prevention, and treatment working together, we can reach the end of the HIV epidemic.